Hello and welcome. Today we're diving into the complex world of autoimmune chorea, a rare neurological disorder where the body's own defenses mistakenly attack the brain. We'll explore what causes it, how it affects the brain, what the symptoms are, and how it's treated.
So, let's get started.
The exact causes of autoimmune chorea are still being researched, but the prevailing theory is that it arises from a misdirected immune response. Often, it's triggered by a prior infection, most commonly strep throat, or other autoimmune diseases. The body's antibodies, meant to fight off the infection, mistakenly target the basal ganglia, a region of the brain crucial for movement control. Genetic predisposition may also play a role, increasing an individual's susceptibility. In autoimmune chorea, the misdirected antibodies react with components of the basal ganglia, particularly dopamine receptors. This immune attack leads to inflammation and disruption of normal neuronal function within the basal ganglia. The disruption in dopamine signaling pathways results in the characteristic involuntary movements, or chorea, observed in patients. The specific mechanism and the exact proteins targeted by these antibodies can vary among individuals, contributing to the diversity of symptoms and disease progression. Autoimmune chorea is considered a rare disorder because it often presents as a complication of other autoimmune disorders or infections. Estimating the precise incidence and prevalence is difficult. Rheumatic fever-associated chorea Sydenham's chorea is the most recognized form, primarily affecting children and adolescents. While less common, adults can also be affected by autoimmune chorea, often associated with other underlying autoimmune conditions. Worldwide data is limited, but its rare nature means collaborative research efforts are essential to better understand its true prevalence. The hallmark symptom of autoimmune chorea is, of course, chorea involuntary jerky and dance-like movements that can affect any part of the body. These movements are often irregular, unpredictable, and can vary in severity. Other common symptoms include muscle weakness, clumsiness, difficulty with coordination, and cognitive or behavioral changes. Some patients may experience emotional lability, irritability, anxiety, or even obsessive-compulsive behaviors. In children, school performance might decline. The specific combination and severity of symptoms vary greatly from person to person. Diagnosing autoimmune chorea involves a combination of factors. A thorough neurological examination is crucial to assess the characteristic involuntary movements and other neurological signs. Blood tests are performed to identify markers of recent infections, particularly streptococcal infections, and detect the presence of specific autoantibodies that may be targeting the brain. Neuroimaging techniques, such as MRI, are used to rule out other causes of chorea and to assess for any structural abnormalities in the brain. A lumbar puncture to analyze cerebrospinal fluid may also be performed to look for signs of inflammation or infection. Ultimately, the diagnosis is based on the clinical presentation, laboratory findings, and exclusion of other potential causes. While there aren't strict classifications of autoimmune chorea beyond its association with different underlying triggers or autoimmune diseases, specific forms like Sydenham's chorea are well recognized. Sydenham's chorea, occurring after a streptococcal infection, is primarily seen in childhood. Differentiating between post-infectious chorea and chorea associated with other autoimmune disorders is important, as treatment approaches might differ. Research is ongoing to identify more specific subtypes based on the target autoantibodies and the specific areas of the brain affected, which could lead to more personalized treatment strategies. Treatment for autoimmune chorea focuses on reducing inflammation, suppressing the immune system, and managing symptoms. Medications commonly used include corticosteroids, intravenous immunoglobulin IV, and plasma exchange to remove harmful antibodies from the blood. Immunosuppressant drugs, such as azathioprine or mycophenolate mofetil, may be used for longer-term management. In addition, medications to control the chorea itself, such as dopamine depleting agents or dopamine receptor blockers, can be prescribed. Physical therapy, occupational therapy, and speech therapy can also be beneficial to improve motor skills, coordination, and communication. A multidisciplinary approach involving neurologists, immunologists, and other specialists is essential for optimal management. Since autoimmune chorea often stems from infections like strep throat, preventing these infections through good hygiene practices, timely antibiotic treatment, and, when available, vaccination against relevant pathogens is important. Early identification and treatment of underlying autoimmune disorders can also help to reduce the risk of developing autoimmune chorea. Regular medical check-ups and prompt attention to any new or unusual neurological symptoms are crucial for early detection and intervention. The prognosis for autoimmune chorea varies depending on the underlying cause, the severity of the disease, and the individual's response to treatment. In many cases, particularly in Sydenham's chorea, The symptoms are self-limiting and resolve within several months to a couple of years with appropriate treatment. However, some individuals may experience persistent or recurrent chorea. Recent research is focused on identifying specific autoantibodies associated with autoimmune chorea and developing more targeted therapies to selectively suppress the immune response while minimizing side effects. Studies are also investigating the long-term neurological and cognitive outcomes of individuals with autoimmune chorea to better understand the potential for long-term complications and to develop strategies for rehabilitation and support.